So in short, we're saying that this thing about Indian doctors or Indian medication is better. But it's really everywhere. A lot of times you find, even when people have a chronic disease, I've seen that a lot. I'm just talking from the social media. So are you saying there's a miscommunication, misinformation, or the Kenyan doctors need to do more to build confidence in their citizenship? And also, you also talked about the board coming in to.
Yeah, there were many of these things which people have just been solicited on commercial basis to go to India. Now the board had to come in, and they've climbed on that. And I don't know how far they have gone because I'm not so much into that.
Yes.
Whatever is going on there.
Of course.
But I know the board is involved with it now because it was too much. Yeah, people are being solicited on a commercial basis, and the board had to come in because they are the authority, the regulators of what's going on. But whether patients have confidence in the Kenya doctors or not, you see, we are providers, the patients can judge us. So what the best we can do is to do what we need to do, the way we need to do it. Then now, consumers will decide where to go. Many times, it doesn't mean that what they are going for is better than the other thing. When you are a consumer, sometimes you may think that you are buying a better product, but what you are buying is worse than what is available in the market. Maybe you don't even know what is the other things which are available in the market. Yeah. But like I'm telling you, with rheumatology, the patients who have decided to go and seek treatment outside there, the majority have come back. In India, when they go, they are put on the same medicines which we use here and called with a different name. So when they come back, they are telling you, Daktari, I went to India and this is what I was put on. Can you put me on the same medication? When you look at it, it's the same medicine we are using here, but in a different name. Yes, the name they are calling it in India is different. So the patient thinks that it's not read anyway. So he thinks that is being given something which is not available in Kenya. In rheumatology, it's difficult there are not very many cases that need to go out. But I'm telling you, the ones who have gone to the highest place there, they have been sent back because they have been found on the right treatment, and we have continued with them to treat them.
So that's really wonderful news to know that the competence of our doctors here in Kenya.
Yeah, I'm talking about some of the best hospitals, I can tell you, in London. Yeah, where the patients have gone and they have been told you are in the right treatment, go back. Yeah, not just simple hospital, the best which can be accessed from Kenya here by the highest authority in the land, which we know of. Yeah.
Okay.
Yeah.
So I think that remains, of course, like you're saying, on the patient.
Yes, the patient to
decide.
To decide.
You can't do so much about
that.
When
they say they want to go, you let them go. You write what you have been giving them, and you give them the later they go. Yeah.
But do you have collaborations with other doctors outside Kenya?
Yeah. We belong to international community of rheumatologists, both in Europe and in the United States.
So you're not in isolation?
No. What we do here, we know how far people have gone in that field in the rest of the world. So when I'm doing something, I'm not doing it like I'm doing it because this is Kenya. I'm doing it because I know this is what is being done all over, and this is what we have. This is what this patient is able to afford. But I know the scope of the whole thing, what we are doing in the world. Before COVID, we were meeting physically every year in Europe and in the United States. Yeah, rheumatologists from all over the world, and we discuss every new thing, and of course comparing to the old ways of management. and anything else. So we belong to the world community of rheumatologists. Yeah.
Yeah, so I think that really builds confidence, because even a Kenyan mind or any patient's mind feels that getting attention outside of Kenya is better. But yet the Kenyan doctors are in collaboration with the worldwide doctors.
Yes.
So there's no difference.
There's not much. There's no difference. The difference maybe when it comes now, it will be what can we afford, because in the developed world, the insurance industry is very involved in the provision of health services, and rheumatology has got some of the most advanced and most expensive medications in the world in the field of medicine. Some of the most advanced, most expensive. That's why even in COVID right now, most of the medicines which are being used to treat COVID are rheumatology medications.
Wow.
Yes. They are medicines we use in rheumatology, because what is killing COVID patients is excessive autoimmune response, and autoimmunity is what we deal with, because our patients sometimes are taken to ICU, rheumatology patients, before COVID, because of excessive autoimmune reaction. You end up in those machines in the ICU, and we treat them and they come out. So some of those medicines we use to get them out of there are the ones which are being used to get people out of those machines because it is the autoimmune process which kills somebody in COVID, not the virus itself. Yes. The body's excessive immune response.
Yes.
Yeah, so these immune modulating medications, we have a number of them. They are in the website there. Normally update.
Yes.
Yeah, they are used there. So some of those medicines are very expensive. In developed world, the insurance industry pays for them. So kind of like they will try to control when should you use which medicine. And there's a big pull back and forth between the doctors and the insurance industry. Because the doctor may feel that I want to start with this medicine, but the insurance industry says no, you cannot use this medicine before you use this one. Because they are expensive.
Because of cost.
Yes. Yeah. So you'll find maybe an injection can cost you 200,000 shillings.
Wow.
And you are to receive it maybe every 2 weeks.
Ooh.
Or first, then after 6 months, after 3 months. But you will have to receive it for the rest of your life. Others are received every week, an injection costing you around maybe 100,000 every week.
Those are huge amounts.
Yes. So we can escalate treatment to that, but now the problem here is the insurance, because most of us are not able to pay that amount of money.
Not able to pay.
Yes. So we give them what they can afford, and incidentally, I was seeing, like, by God's grace, we didn't have to go very far. What we could afford was working, but now as time continues, you find that you need some of those expensive medicines. Yeah. So those who can afford, get them. The others, we continue to fight just to see how to manage them with what they can afford. But it's not for lack of information. It will be for lack of the resources. Yeah. So that one again, if we can have an insurance, this health service, what do you call it? Universal health care.
Yeah.
If something like NHIF can be able to provide medication for rheumatology patients when needed, as determined, yes, then we can regulate it, because we are able to know who exactly needs it. The problem is sometimes some people need it, but the insurance is not willing to give.
Says no.
Yeah.
Because of course the cost.
Because of course.
And also sustainability.
Yeah.
Okay.
Yeah.
So in brief, as in closing, as a parent brings a child experiences these symptoms, of course, their huge worry will be cost and whether they can sustain the medication. But I've heard you saying that there are medication that it's not so costly. And
You see,
yes.
normally, you see, diseases behave in different ways, and you don't want to preempt where your particular disease or situation is going to end.
Yes.
Yeah. So normally you go for medical services.
Go for medical services.
Yeah. Let things go the way they need to go.
Shouldn't put the cart before the
No,
horse.
no. The thing is to find the correct medical services, and get the correct medical advice.
Don't think about the worst.
No.
Just
do the right thing. Do the right thing.
Do the right thing.
Yes, because really we are not in control of life
that's very good.
as such.
Yes, yes.
No. We are not in control of life as such, but you do what you are supposed to do. And let's see what happens. Yeah.
I think that's a very encouraging note to end.
Yeah.
You know, in terms of as a parent, you can begin from where you are, what you see, and seek the medical
attention
as soon as possible, without so much thinking about what you don't know.
What you don't know. But now the most important thing is to sensitize the community so that they can be able to seek medical attention. Because even now, if the community knows that this particular disease should be dealt with by this particular doctor, even when they take their child to the first medical attendant, they have it in mind. You know, you are sitting there and waiting to hear what the doctor will say is the diagnosis with your patient, because you already think that you already know where you can go with a particular situation. You know, that is better than when you just going there without any idea of anything.
Yes.
Yeah. So it's like, so you are saying my child has this. Do you think he needs to see so and so? Do you think he needs to see so and so? You see? Yeah. You see? So that you can wake up also the medical providers who are not really getting you to where they need to get you. Yeah.
Okay.
Yeah. So you need both an informed public and the medical profession. Yeah.
Yeah. I think the good thing is that because the medical profession is already informed, the public should at least do some effort. You know, and that calls for the government, calls for such interviews, calls for actually you guys who are doctors to make these interviews often and look for ways to disseminate
them. Yeah.
Out there, you know, without thinking about so much whether the patient will come to see you or not, but you just do the right thing to get the information out there.
Yes.
Yeah. Okay. Great. So thank you so much, Doc, for your information. And I think next time we can look more into the other diseases like lupus and gout or such, so that we can be more informed about these things.
Okay.
Yeah. So thanks so much.
Welcome.
I think we'll close it there.
Thank you.